Yeah, I want to show you something today, a little bit to go a little bit under the hood. If you drive a car, okay, nobody knows so really what's under the hood, and so I give you some insights what's happening at the moment worldwide in the field of interoperability, and we combine that in the Grapevine World. So I go a little bit back, it's just 50 years, it's not that long. Yeah? Walt Disney has tried to build up a perfect community, Epcot, Experimental Prototype Community of Tomorrow. The basic idea was to make a perfect world for 20,000 people with a perfect landscape and logistics and kindergarten and everything. Unfortunately, he died too early, but one thing he built up was in his mindset was to bring in all the stuff in the Celebration Health Hospital because he died on a lung cancer, and his idea was to bring all the pieces together in a hospital to make the perfect healthcare. Today, I would say it's called Smart City. 50 years ago, it was Epcot. If we jump to the challenges in healthcare, it is the issue still that you as an individual or as a citizen, you're not able to get access to your data. I have to say to your data, not just healthcare data, because we are reaching out also to other verticals like energy and like the publisher market. And so for an individual, it's still a problem if you want to get access to your data, and you know your data are lying around the globe, so it's still a problem. For professionals, it's the same. If you go to a hospital, of course, then you get always the same question. Yeah? Please give me all your information. Then you have to register yourself. You have to fill up the forms. And again, it's always, it's boring, of course. And the healthcare system itself is not really very efficient because all the data are stored in silos in a proprietary way. It's not that easy to connect all the different facilities. This is now what Alex mentioned, integrating the healthcare enterprise, IHE. They are working, this is a non-for-profit organization, they are working really hard since 18 years to bridge the gap. The problem is still interoperability. Let's assume in the world of Internet of Things, you want to enter your garage and the coffee should come automatically. You need something in between. You need a specification. You need a kind of protocol which is in between. Otherwise, it will not work. I bring you an example with out of the healthcare space, and that was the starting point where IHE was starting out of the radiologist space. If you get a treatment with a computer tomograph, you have to transport the images to a workstation, and the radiologist, of course, is doing the report. Of course, you will find the standards behind, and it was clear that you have to send the images in certain standards. In this particular case, it's called DICOM. But in the standard itself, it isn't defined that you have to fill up certain attributes. It isn't mandatory. So that means you can use a standard today, and you will find thousands of standards today. And if nobody is specifying what you have to put into it, then you will not bridge the value chain. And in this particular case, if you're not filling up the birth date, and the doctor is sitting in front of a workstation and is seeing the picture, and he's not knowing how old you are, then it's somehow senseless. Yeah? So IHE has said, no, we are selecting the standards for certain use cases. But then we have to specify what the companies they have to put into those standards, otherwise it will not work. That was the starting point. It was a starting point, and believe me, we were together in a room with 20 people and we tested the products against each other. If you look today, 18 years later, we are running so-called connectathons, interface marathons, and 500 people, more than 500 people are sitting in a big hall more than 80 or 90 companies, and they're testing their products against each other. So today you're really able to live interoperability, but nobody knows it really. The whole community, all the vendors are ready to go, but of course, from a political standpoint, and also from a market standpoint, some companies are still interested to keep the lock-in situation that some, of course, organizations and customers are locked into a certain proprietary platform. With this approach, you're opening the world, you're able to connect all the different systems, and this is what we are doing since 18 years. The Grapevine World story is a story derived from the Walt Disney story. I said last year, we have to stop that we are bringing out every year thousands of tons of standards and initiatives are running in the European Commission. They're bringing out initiatives. In the US market, they're running initiatives. Everybody's running initiatives, but nobody is able to say, fine, I have like the internet, I'm able to share my data through the internet with this certain layer, the application layer, and this is the Grapevine layer. We are building up the Grapevine backbone. This is the current situation at the moment. All the different systems are really in a way, in a not connected way, disconnected, and that is not really helpful for the whole market. So what we are bringing together is now the robust building blocks, the robust frameworks, all this proven technology together with the blockchain technology. I'm coming from Cleveland last week, and I can tell you it was amazing. We were running a strategic meeting, and IHE is now really willing to reach out to the whole blockchain community and also to the IoT community. This is a big step because that means that IoT and blockchain will be part of IHE. The whole process to define all the certain attributes in the specification will be done also for the blockchain community and also for the whole IoT industry. That is a big step for us, and the next news also is that IHE itself, the methodology of IHE to do this, to run this process with all the connectodons, they will reach out also to other verticals like energy, smart meters, smart grid, Internet of Things. The publisher last week, I think some of you know Bertelsmann as a big publisher. He is also committed now to run this IHE process. The whole publisher industry wants to go this way now. So we are combining this with the blockchain, and the reason is we say, okay, for the commercial part was missing to set up a complete new economy. So we have to have the right stakeholders, of course, in the ecosystem, but then we have to find also a way how somebody able to get the reward, therefore. And blockchain is, I think, the perfect way to combine both the robust framework with the blockchain. Based on the fact that blockchain itself will be part of IHE, this is just an intermediary step, but for the commercial part, we have seen it. It's fitting perfect, and what we heard also today, by the way, really, I think it's amazing presentations. You can use the blockchain technology to, let's say, to set up a complete new ecosystem. We got also last week the clearance from the fintech market. The fintech market is also interested to join the IHE group because they are seeing also a new chance to set up the contracts based on the fact that you're able to use smart contracts and so on to set up a complete new economy. If you talk about use cases, certain use cases now, a typical use case is now that the pharmaceutical company is requesting, of course, let's say I need 1,000 patients with diabetes type 2 in London. So I'm sending out a request for a special patient profile, and as a patient, I'm able to give consent, therefore. The difference is now that we are not storing any medical data, of course, in the blockchain because it isn't allowed about the GDPR. And what we are doing is just we are giving consent for giving access to the healthcare provider. So we let the data remain in the whole ecosystem at the healthcare provider side. Of course, you're able to, if you want to, you're able to query your data, and I'm not sure if you're aware, if you heard the announcement today from Apple, because we are working also together with Apple through Cisco Systems, a big network provider, and Apple is providing since today a new personal health record way. So Apple is working now in a way that they have a kind of collaboration with certain hospitals, but to be honest, it will not work in a scaling because you have to inform every hospital, every doctor worldwide, and you have to connect every legacy system worldwide. So it will somehow work. I think if you remember, Google tried it. Of course, it was 8 years ago with Google Health. Then they stopped the activity. I'm pretty sure from a convenience perspective, Apple will succeed because if you have some data on your smartphone, it's fine. But to give, of course, every doctor and every physician now the consent to get access, it will not that easy. But anyway, it's the personal health record. This is a platform, it's the whole platform for connecting all the different facilities worldwide. So you're getting a certain amount of CRAPES as a patient, and the healthcare provider is also getting some CRAPES, and maybe the analytic service provider is also getting some CRAPES. Another use case is now, because we are talking about a utility token. Why? It is a utility token because you are able to reuse your token now for a typical use case for second opinion. So if you send out now to this Grapevine backbone a request now to experts, then of course you can use your CRAPES and you can ask the medical experts out there for a second opinion. Therefore, you have to pay, let's say, I don't know, 100, 200 CRAPES. It's equivalent, let's say, of 100 euros. And then you're getting expertise from the expert network. I think this is a nice case because second opinion, I think if I'm going to my family, I'm getting requests every day for a second opinion because everybody's asking me. They know that I'm working also in the healthcare field, and everybody's asking me, do we have a doctor? I need a physician. I need this and that. And then, of course, I'm reaching out to my friends because it isn't that easy to get the right answer in this field. So this is a typical case. So maybe you have to spend some CRAPES. The healthcare provider is also getting some CRAPES because, of course, they are providing the data for you. And then the experts, of course, they are getting the CRAPES for their expertise. Health data access, exchange, and utilization, this is a huge market. Of course, it's not just healthcare. If you're reaching out to other verticals too, you know, if you're able to utilize your data, this is amazing. Nobody knows what Google is doing with your data and Facebook. Everybody knows that they are making money out of it. But if you are able to utilize your data in future, I think this is a big step. What we started, as I said, I started last year in January to found the Grapevine World. The white paper is finalized. You will find it on the www.grapevineworld.com. So we are in a pre-round now of the ICO. The ICO itself will happen in maybe, let's say, in June, end of May, beginning of June. So community building is now the job that we are doing because with all the big companies, of course, we got the clearance from really huge one that they are really interested to be on board. And then the token listing, of course, will be end of 2018. So that's the roadmap. This is it. So if you have some questions, I'm open therefore. Yeah, maybe the advisory team, I can tell you something about. Of course, we are 17 years now in this market. We connected Europe somehow. We connected 23 countries in Europe. We are also located in the US, in UK. We have a lot of experience in this field, and we want to bring in this experience in this field, of course. Thank you.
So, give a big hand of applause.